when a body is twisted, it's affecting the lymphatics, it's affecting the vascular system, it's affecting the neurological system, it's affecting the muscular system, it's affecting the organs. So it'll be digestive system, it'll be affecting, if it's meningeal, if someone's under a lot of meningeal tension, it'll affect your hormones because it's a distribution. It's structure equals function on such a global scale that for me, and what I do and what I love, this is where the foundation is. You get your posture right and a lot of things can change. Your butt is higher than your knees. Okay, get comfortable and now take a breath. Well, already you can see your posture's changed completely. Your shoulders.
Oh, wow. I mean, yeah. I mean, I can't even believe how much deeper I can breathe. Wow.
Yeah.
Okay.
So what they came up with, they did a study on, I think, about 4,000 people in an old age home. And what they figured out is that the more kyphotic you are and the less likely that you can lie on your back flat with your head on a flat bench, your mortality rates go up. So you basically, your longevity, how long you live, your life expectancy is very closely related to what is happening at the top of your spine. So then person who has a scoliosis, in our mind as a definition for us, is that in their spine over time, bones have gone forward and the body is compensated. But a scoliosis is a double compensation. It's a compensation on a compensation. So there's even more torsion, twisting, tilting. All the angles can be different in all different places, and usually in an S-bend or C-curve, like you said.
Welcome, and thanks for joining me, everybody. So I had the opportunity to talk with Natalie Robertson. She is the director and leading ABC practitioner at her own practice. Her practice is known as Spirohealth in London, UK. ABC is a modality known as Advanced Biostructural Correction. Really amazing stuff. So as most of you probably know, I'm always seeking to find people who are doing unique and effective work in the health, wellness, and movement industries. We just say, nobody fits this category more than Natalie. And in this video, you're going to learn game-changing information about the work she does. So, folks, she's a leader in the field of helping people to live a better quality of life. She and her passionate team focus on a move well, eat well, think well theme, all while creating a warm and safe environment and place for their patients. So I hope you enjoy this interview, and if you like our content, the best possible way to support the work we do is to hit the subscribe or the follow button below and share it with others. We appreciate that so much. So let's get into this awesome educational content with Natalie, and thanks so much for watching. Enjoy.
Well, Natalie, thanks for joining me. How are you doing today?
Good. And you?
Yeah, it's really good to have you with me. I've been checking out the work you do, and I'm so glad that we connected, because I'm sorry to say I was not aware of you or the work you do until our recent connection a few weeks ago. And now I'm one of your stalkers now on Instagram and everywhere. And, you post great information. The thing is like, I know that I know a lot, but I also know that every day I seek to learn more, because I know I'll never be able to stop learning. I have to learn and learn and learn, because there's so much to know. We can always get better at what we do. And you've added to my plate now. Thank you very much. So thank you for joining me. Yeah. Thanks for joining me. Tell us, what do you do? What are you doing? What's your business? And just tell us about it, because your work is amazing.
Brilliant. And I'm so glad you've obviously come across us, because I think not only you will learn, but you'll be able to put this in a toolbox for your clients, which I think is going to be, way more powerful.
Absolutely.
So I do something, well, simply put, I fix bodies. So that's kind of, we use it as a tagline. We fix bodies. It's more of a structural approach. We fix posture, because there's a lot of untrue things that people believe about their posture, in terms of, okay, I must sit up straight, put my shoulders down and back, tuck my chin in. If you're having to think about your posture, you've already lost it.
Yeah.
Our bones and our frame are designed to keep us upright, have us breathing, have us looking around, obviously to protect ourselves. So when you stack the vertebra, which are the little bones in the spine, up in the correct way, we just stand. We don't have to think about using muscles or, breathing in a certain way or anything like that. So it's really just going back to basics of restoring the natural curvature to the spine.
Mm-hmm. Yep.
But we do it, Carl, in a really specific way. So, I studied chiropractic, qualified 2005, and I did a technique which I obviously at the time thought was great, diversified, which is very pain-based. So people come to me in pain.
Mm-hmm.
And I stumbled across this ABC, so Advanced Biostructural Correction. It's quite a mouthful.
Mm-hmm.
Stumbled across this by having an adjustment myself. And I was like absolutely shocked because as a chiropractor, and I've been qualified then for 7-8 years, to be aligned in one appointment and feel something I've never felt in my entire career, even my 6 years of studies, it actually bowled me over. I was like, I've really got to look into this. So that's what got me into it, because I was breathing differently, standing differently, acting differently after one appointment. And so that was me hook, line and sinker. And now it's 10 years down the line of doing ABC, and instead of having sort of miracles happen in your office once in a blue moon, these things come around almost weekly. So it's great.
I love it. So I have this ABC, Advanced Biostructural Correction, as my very first question. And so Mike, basically, can you describe what this is? Because I'm dying to know.
Very simply put, we fix things in your body that you can't fix so you can fix yourself.
Okay.
And that, by definition, in the spine, if you're just talking specifically about the spine, so the vertebrae make up the spine. They're like the building blocks, like Lego pieces.
Mm-hmm.
And we have muscles attached, as you know, and probably most of your listeners, we have muscles attached in the spine, tiny, tiny, tiny little muscles, so that if you fell asleep on the couch, you don't have to call your partner, your friend, your son to come and help you get up off the couch and straighten up. We have the ability to correct ourselves. We don't, Carl, have the ability to correct ourselves when one of those vertebrae has been pushed in an anterior, so that means front, direction. We don't have any muscles attached behind us that can pull one back on the other.
Oh, sure. Yeah.
So now a lot of people say, well, in the gym or yoga, I've definitely improved my posture. You can activate muscles, and you can strengthen your back chain, you can strengthen your front chain, you can do all sorts of things, but that's an aesthetic, that's a look. Sure. That's a muscular thing. From a structure perspective, when these bones go forward, and it doesn't have to be from big traumas like car accidents or rugby tackles or, falls and traumas, it can be everyday habits of how we sit, what we sit on, how we sleep, what we sleep on, what pillow height we have, what car we drive, depending how many hours we're in there. So these bones go forward, your body can't fix them. So because it can't fix them, instead of falling over, you don't see people on the street falling over. Your body compensates for this by twisting you around and back up. And the twist is usually in another place. From my perspective, if people come and see me,
excuse me,
if they've got knee injuries, ankle problems, shoulder issues, jaw issues, even stuff in the cranium, I will think, right, that is where your body is twisting up to compensate for something in your spine that is stuck forward. So I'm going to look in the spine, see where the problem is. We fix that, and your body will unlock and unwind because it won't need the twist or the compensation anymore to be upright.
Totally fascinating. There's an old saying that I heard. I learned it from Dr. Perry Nicholson. Do you know Perry? Stop Chasing Pain. Oh, I have to introduce the two of you. He's amazing. You'll love him. He'll love you. And I think it came from Ida Ralph. It says, pain is where it ain't. In other words, where you feel it is, you feel it there, and there is pain there, but where it started from, you may have to follow that back a ways. That could go a few pain points back to the origin. So I can see, what you're talking about here. Well, we're so, everything is connected to everything else, right?
Absolutely.
Could you give us an example, a common example of what you see as, let's say, an issue somebody comes in with, I have, is it low back pain? Is it shoulder pain, knee pain, hip, whatever it is? What's a common example on how you might address it?
Okay. I think before I get into that, just going back to the body's one synchronous unit.
Mm-hmm.
You can't be isolating and working on an injury. Just like if people want to lose weight, they can't spot lose. You can't go, right, I want to lose on my bum, so I'm going to focus on it. Just doesn't happen. It's one synchronous unit.
Yeah,
So
right.
that's how we work. So for me, if an example, so say somebody comes in and they say, okay, I've got headaches, I've got neck pain, on one side, I've got, my trapezius, so the top of your shoulder here is tight, can't focus, can't sleep with it, tossing and turning in bed. When I look at the structure, I'm looking at the whole body, front, back, and side. We take postural digital pictures and things like that. We're not X-raying unless obviously there's a recommendation too.
Mm-hmm.
But we look for the head position of the posture. So is the head forward?
Mm-hmm.
We look for, are the shoulders rolled forward? Sometimes the shoulders aren't rolled forward. Sometimes people are compensating the other way and the shoulders are pinned right back. That's a lot of effort as well. We look for what we call fold points. So if somebody breathes in, so the listeners right now, if you're sitting in your car or whatever you're doing, just take a deep breath in, and as you breathe out, let your body slump. Now, the slump points and the places that you fold at, particularly over just underneath the pecs or underneath the breasts, that's where you have a bone that is stuck forward. So I look for these fold points. I look for how big and open and easy it is for someone to breathe. Are the ribs moving?
Mm-hmm.
We have a look at the lower back, see if there's a hollow in the back, so people are more sway back kind of thing.
Yeah.
And obviously, I haven't had one person come into my office looking the same, which is what really helps with, my work is so different every day. It's amazing. I'm sure you experience the same thing.
Oh, is that, actually, even if it's the same person coming once, twice a week, 3 times every day, especially in the movement disorder world that I'm very involved with, Parkinson's and other things, every day is different for all of us. We can feel completely different today than we do Thursday morning, let's say this week, or Friday morning. And maybe we have pain in a different place that day. But yes, it keeps us. That's one thing I love about this business is it never gets boring.
Exactly.
And we're always challenging our brain, always challenging ourselves to analyze what's going on and try to help fix it.
Every day is a school day.
That's a good one. I love that. I'm writing that one down. I'm going to steal that one and put it up here on the wall. Okay, go ahead. Yes.
Something deeper, I suppose, than what I'm speaking about, and probably what sets us aside mainly from other mainstream chiropractors, osteopaths, or posture expert practitioners. We work with something called the meninges, which I know you'll be familiar with. So, I see the meninges and I envision it as like a skin, covers the brain, covers the spinal cord. It's got 3 layers to it, which are usually really loose. So if somebody has had their life where there's instances where bones have gone forward because they haven't been aware of posture and things that might be doing that. So you have this bone that's stuck forward, you can't fix it, and as a result, your body's twisted up. Now that's happened multiple times. So now you're in a pattern. Now your body's in a pattern and it's using a twisted body that wears us out. So the meninges, they are not so loose anymore and they get caught up. It's almost from like a friction-based force. And you get these, what we call meningeal scars or adhesions. So you can see them on cadavers. It's easier to see on a cadaver. It's not so easy to see on, obviously a human body. MRIs, sometimes MRIs can show us a bit more than an X-ray would, of course. But what these meninges do, these adhesions, is they hold you, they lock you into a place, which is protecting you in a way because it's stabilizing you. But it's also locking these bones into a position that they shouldn't be in. So 1, your range of motion goes off. And then 2, the meningeal tension, the extra meningeal tension can now create things like, you've got your brain fogs and, the brainstem is under tension. So suddenly breathing rates, blood pressure, balance is off, digestion can be off, sleep patterns are off. And it's not to do, yes, it's structural, but it's more a meningeal cause. So what we do is we do some weird stretches. And I'm going to say that again. We do some weird stretches because the stretches are not for muscles or joints or for anything like that. They are for these meningeal scars or meningeal adhesions.
Yeah.
So we do stretches, and then the second part of any treatment is then looking for and testing. We've got a very specific way that we test for and find out which of the bones in your spine is stuck forward. We only fix those.
Okay.
We only fix those. And then we also work down into the legs and feet and the arches of the feet, because those are maintained by bones. And we do some endonasal, which is actually work through the nose with a small balloon, because the sphenoid bone is like the base. It's such an important part of your skull. It's, the brain sits on there as well. So we make changes to the position of the sphenoid by using this little balloon. And what that does is it allows us to carry on unlocking, because some people will get stuck and we won't be able to keep unwinding and correcting their bodies if something is obviously holding them in place from the top. So it's like a puppet string.
Yeah, see, okay, I have a question. I have a lot of questions, but I'll make a comment first. First of all, one of them is, I heard a long time ago, I think it might have been Perry Nicholson said, and a lot of people have said this, we take the shape of our environment. So if I sit all the time, I tend to take that posture, that pattern. If I'm like this all the time, and on my phone all the time, I get the forward neck, or the spinal flexion. We have a gentleman who comes in with we see quite a little, I'm sure you see a lot of scoliosis, various forms, various shapes, the S curve, C curve, different, but I find it interesting that this lifetime of repetitive movement in the industry that he was in is likely what caused that, because of how he always had to lean to the right and up like this. So now we have this scoliosis. He has a small S curve from the bottom of the thoracic to down to the sciatic, where that's, so that's a comment, but now there's a question attached with this. I'm just curious. One thing that I explain to people is, and correct me please if I'm wrong, because I don't want to misinform anybody, but on our thoracic region, we have bones, we have ribs coming in for support, to help support us. We have muscles, ribs, and this and that. And then down in the S, we've got the hip joint, the hip bone down there, but in the lumbar, pretty much just muscle. And it seems like a very vulnerable point for a lot of us, which would this be a lot of the reason for scoli, especially in lumbar region, or maybe low back pain, because it's just weak, maybe weak core? And I'm curious to know what you think about the lumbar region in particular. Is it more vulnerable, generally speaking?
So I would challenge that, just if I'm looking through the lens of ABC only, Carl, I would challenge that theory, because with somebody who might be twisted to the side, that is actually a much better position, because the body can fix things that are twisted, tilted, rotated, even things, it can't fix something that is in an anterior position.
So that, okay. Yeah, this is new to me, and this is really, really interesting. Yeah.
So then, person who has a scoliosis, in our mind, as a definition for us, is that in their spine over time, bones have gone forward and the body is compensated. But a scoliosis is a double compensation. It's a compensation on a compensation. So there's even more torsion, twisting, tilting. All the angles can be different in all different places, and usually in an S bend or C curve, like you said. For us, though, and it's not known, we can change scoliosis. We can shift it. And what's so interesting is that I've worked with, remember a little girl that I worked with, a young girl, and the parents were considering surgery. And we said, look, let's do some really intense work. Let's see how far we get. And we managed to change her, I think it was like a 8 to 10 degree drop in her scoliosis in one angle. In the other angle, it got slightly worse. And I put that in inverted commas because when we looked at her from the side, she was more upright. So she had more space to breathe. She had better digestion. She could stand easier, things like that. But from an x-ray that was taken A to P, there was actually an angle that looked worse, but it wasn't worse. It was just untwisting. So one part had corrected and the other part hadn't yet. So you've got to imagine like a 3-dimensional untwisting that happens with these people.
That's amazing. So scoli can also go anterior, right? So if it doesn't have to be lateral. It can be
Yeah.
like, if I'm drawing a spine, and let's say the body's this way, it couldn't be going like this, right? And then would that be considered, are you checking for, you know what, let me go back and start over.
Mm-hmm.
It can go that way, but regardless of scoliosis or not, you're going to be checking these discs, right? And so you do this through imaging. Is that the first process?
So we obviously we do the examination, so we'll look at the spine, testing orthopedic, neurological tests, the whole bank sheet, and then medical history comprehensive. And then we take postural pictures. So if you have a look on our Instagram, I put a lot of before and afters, because you will see how long I've worked for someone, for instance, and you can see how their kyphosis, lordosis, everything is shifting. So they're not hunched anymore. And there's a few scoliotic clients I've put on there where you can see the shifts. So from the side, you can see them more upright, but then from the front, you might see them a little more twisted over to one side. And then people say, oh, but I'm more twisted now. And I'll say, yeah, you're more twisted, but you're actually unwinding. So everything's improving with regards to your tension and your function and your performance. But you do look from the front a little more twisted, but your anterior, posterior, there's been a big change. So it just takes time.
Yeah, I'm just pulling up the Instagram right now.
See if I can show you a specific one. I've put a lot of reels, so there's a lot of things to get through there. I'll see if I can.
That's where I've been following most of your things, and I'm why am I not finding you? I'm typing wrong.
Spirohealth.
Okay, here you are. All right, so
if you click on results, there's a lot of results there. But then if you just go through, so scoliosis can be changed. It's probably like the third picture in there of results in my results tab.
Oh, okay, results. Here we go. Results. And folks, if you're listening instead of watching, oh, wow. Yeah, look at this.
Yes, that's Paula. She doesn't mind me talking about her. Everybody's released their pictures for us. So that's a tricky one for the scoliosis to see, because the lighting isn't great. But I mean, that's considerable changes.
Oh yeah, these changes are, and I mean, how quick are these changes happening?
Well, this is the thing, and it depends on the person's body. Sometimes I can do weeks worth, and people are just changing like crazy. But then if someone is really twisted up, I mean, I've got an 8-year-old girl I'm seeing at the moment, and probably from birth, she has been dealing with these bones that are stuck forward and her body's been compensating. So she has what we call a shelf. She's already got, like when someone's really hunched over and kyphotic, and she's 8. So like you said, it's down to using her phone and her iPad. Her parents, that's all they give her.
Oh, yeah. Yeah, that's rough, man. So yeah, I have a number of questions here. Let's go through, if you don't mind, can we go through a process of, we come in, somebody comes in, you're doing imaging, you're doing all the things you do, taking intake, information, medical history, and all this stuff. What are we doing? How are you addressing the anterior discs, and how would you fix? I'm really fascinated to know. I have no doubt. I know you're doing this. This is not a question of if you are. I want to know if you're willing to share a little bit about how can you take a specific disc and work on the muscles around that, or the meninges, because I'm so fascinated with this.
So it's not the disc we work on, it's the vertebral body.
Okay.
So we're working on the vertebral body, not the discs. And we use a specific test to help us figure out exactly which of the bones in your spine are stuck forward. So once we know which of the bones are stuck forward, we then do all of our work up against the wall. So nobody takes any clothes off. It's all up against the wall, because obviously that's where we're standing and breathing. So it makes sense. And then we do some gentle work on the bed as well. And it's all about leverage, Carl. So if a bone is stuck forward, my hand position is slightly underneath the bone underneath, which is usually stable. And we are then correcting very gently. We don't work against the spine. We work with the spine I learned that a long time ago. If you're going to push, the body's going to push back in some way. So we work with the spine. We work on correcting these anterior bones. The meninges is a little different because they've got attachments up in the skull, like in the skull and in the mastoid, like mastoid area, and then obviously right down, and they anchored into like S2, somewhere on the sacrum. So when we're doing stretches, you've got to think of the canal, of the spinal canal. You've got anterior, posterior, and lateral sides, really. So our stretches are anterior, posterior, and lateral. And we anchor in one part.
I'm really, really sorry. I just had an ADD moment. Can you go back 1 second? Our stretches are anterior, posterior, and lateral?
Anterior, posterior, and lateral, yeah. So if you
Okay,
think of
all
a
right.
canal, front, back, and side.
Yeah,
so front,
okay.
back, and side. So on a particular day, we test the person to figure out if they have any of these meningeal scars on that particular day. Because as they're unwinding, you're going to have different things show up on different days.
All right.
So we stretch out, side stretch, front stretch, back stretch, and like I said, emphasis on weird. Very, very weird. But I mean, I see 90-year-olds, I see newborns, I see teenagers. So, you can tailor make these things. There's such brilliant research. I'll mention it. It's Rancho Bernardo, the Rancho Bernardo study.
Okay.
So what they came up with, they did a study on, I think, about 4,000 people in an old age home. And what they figured out is that the more kyphotic you are, and the less likely that you can lie on your back flat with your head on a flat bench,
your
mortality rates go up. So you basically, your longevity, how long you live, your life expectancy is very closely related to what is happening at the top of your spine.
Oh my gosh. See, this is the gravy right here. This is like what do they call this? The silver lining of information. One of the pieces of silver lining, because we're finding, I don't know who we are. I'm just saying what I'm finding through listening to and learning from experts like yourself is mortality, a lifespan, health span, longevity, quality of life is so closely connected to many, many different things. And now I just learned a new thing. I did not know about this, but it totally makes sense. If you can't lay down on your back, put your head on not a thick pillow, maybe even just down on the bed, which sometimes I find to be a problem, but I'm working on it. If you're crunched forward like that, if you're kyphotic, it seems like things won't work as well inside, right? Your internal organs probably aren't working as functionally. And I had no idea it had to do with life expectancy, but wow. This is an aha moment for me.
All of the research, or the main, I should say that ABC is based on. So if you want to go and geek out and look at some stuff, there was a gentleman called Alf Brigg. Now, what he saw is that when you go from standing to sitting, so when you are, is it standing to sitting, or it's flexing? So when you're flexing the head down, you're flexing your body, the spinal cord is stretched by an extra 3 centimeters. So that's
actually quite a bit.
It's huge. So if you are slowly but surely getting more and more hunched over, more and more round, and more kyphotic, that's putting more and more tension on your spinal cord, which is then why obviously it'll affect how long you live, because your nervous system controls everything in your life. So his name is Alf Brigg. So he figured that out. And what he did with these people who had some very hard neurological symptoms is he stuck them back. So he screwed 2 screws in the skull and then a ribbon through the top of thoracics. And he pulled these people into extension. So now they were living like this. But when they went into extension, their symptoms went away. So he helped them with the symptoms, but now you can't live your life stuck in extension for the rest of your life.
No.
Then there was another guy called Yamada. I think he was Japanese. And he figured out that if you release the tension of, so the spinal cord ends at like L1, L2, and then there's the cauda equina, which is the nerve roots just at the bottom. So he figured out that this meningeal stuff that I've spoken about could develop as far down as that. So what he did with surgery is he snipped the meningeal scars and tension that was there. So when he did that, people obviously, again, they improved. Things like, foot shape restored. So arches in their feet restored, and all sorts of things changed after he snipped those things. So from an ABC perspective, we deal with both of those without having to do surgery and without having to stick you back into extension, because we release the pressure and we stretch out these meningeal scars with these stretches that we do. And then the second thing we do is obviously work on the structure. So it's very likely that somebody who can't get their head back on a flat surface when they're lying down, after they've spent a couple of months with us, they will be able to do that.
It's amazing. That's beautiful, because that's a problem for so many people. And actually, I'm one of them a little bit, and I've had to work on it because I don't want to lose that ability, because it's painful sometimes to lay down and put the head right on the floor or whatever.
Then you also, as you're trying to do it, you're going into extension. So it's like,
absolutely, yeah. That's exactly. And it doesn't seem like it should be that way. I don't like how it feels. Cuts my air supply is different that way. It doesn't feel good. Can we go back for a minute? Unless if there's something you want to say now, go for it.
No, I just wanted to say I'm going to put you in touch with someone in New York that does ABC, so you can experience it yourself, and then we can talk after that.
Okay, good. Please do.
Yeah.
Please. Okay. I want to go back to when we first started talking. You mentioned something about twisting. Can we talk more about the twisting aspect of, let's say, a dysfunction, and then maybe the body, how it twists, and then how do we untwist?
Okay. So twisting is probably the simplest term for compensation. So when these bones go forward from, repetitive actions that we do, as I've mentioned before, our sitting habits, our sleeping habits, the shoes we wear, the cars we drive, bones go forward, body can't fix them, so we compensate or twist up. Now, the twisting doesn't only happen in that area, the whole body will do it. And when somebody presents with an injury, like, oh, my ankle suddenly blows up and swollen and my knee's clicking and locking now and I can't use my left leg properly, in my head, I'm like, right, your major biomechanical twist at the moment is in your leg. And now you're walking, obviously, on your legs, so you're creating problems for yourself. And the diagnosis could be anything, Carl. It could be ligament problems. It could be your meniscus, your cartilages are problems. So you go to the doctor and you get everything checked in your ankles, and it's all tendonitis and it's all swollen. And, that's fine. But from our perspective, we're like, right, let's fix the cause. So we go back to the spine, we figure out what's stuck forward. We have numerous sessions with someone where we can do either these meningeal stretches and the structural work. So when the body's now going, okay, so the bones that were stuck forward are now fixed up, I don't need to be so twisted anymore. I don't need this compensation. So I'm going to let go of it. So it lets go of the compensation. And then the ankle gets better, the knee gets better, things get better. And then that's what we do. And then the body unwinds itself. I suppose
the only reason I'm being quiet now is because I'm trying to process this all in my head, because it's the coolest stuff in the world.
It is really, so cool. You just literally see it in front of your eyes. And, even in an adjustment, I've got mirrors everywhere. So as I'm fixing people, they come in, one shoulder's dipped, one shoulder's rolled in, one hand is coming over, and they come in, breathe in, breathe out. And I do my little tests. I fix maybe a couple of segments, and then we look back in the mirror, shoulders back, down, arms on the other side. And I'm like, wow, you've already started unwinding in front of my eyes. It's great. It's great.
Writing down a couple things because I don't want to forget to ask you these things. Okay, I just had a thought and I lost it. So let's move on to the next one until I remember the last one. I have two gentlemen who come in here with PPMS, the rarest form of multiple sclerosis, primary progressive multiple sclerosis. This particular form of MS, from what I understand and what I've learned, it affects the myelin sheath or something around the spine. It's usually down lower L's, upper S's. And what tends to happen is the message from the brain to get the legs to do the job of coordinating movement or stepping, let's say, any kind of movement, diminishes over time. Have you ever seen this? I'm just curious if you've ever seen this and there's anything special that you would do to address it to maybe help them.
So I haven't personally seen anybody with that particular type of MS. I've seen some early stage MS. I know that around the world from colleagues that I've spoken to, and I have to pay credit to the genius who is Jesse Jackowitz, who actually discovered this technique. So he obviously, worked with a few other great people, but for himself, he's the one who's trademarked this is his.
Okay.
And there's some great videos on YouTube where he's worked with people, and you can see him real time adjusting someone who has MS, and you see their movement patterns, and then he does an adjustment, and then everything changes. So what I would say about the neurological chronic sort of diseases is, from an ABC perspective, we are restoring as much as we can the natural curvature in the spine, which then helps nerves that may have been stretched. Now, myelin sheaths that are disrupted, obviously, that will affect the transmission of nerve information from brain, spinal cord to the muscles or organs, etc. But what we're doing is we're taking the stretch off. So if someone is stuck forward, we're restoring as much of the natural curvature as we can. If someone's backwards, we'll obviously change that, because as the body's unwinding, it corrects. So when you can align a nerve and take tension off of it, it transmits better.
Sure,
There's three different grades.
I bet it does.
Was it desensitization of a nerve? So there's three different grades. One, obviously, where you can, a completely severed nerve is probably not going to recover. But if something has been stretched to a certain degree, there is a recovery there as long as you keep them aligned.
Okay.
So, it's like two fingers that you bandage together. If you leave it long enough, the skin actually joins together. So the body's just got that. It's got that ability.
Yeah. I was just thinking, I saw this thing about in China way back, decades and decades ago, centuries maybe, about women who wore these shoes that were way too small for their feet, and how their toes would grow together. They're just like the foot had no toes anymore because they all grew together. So, okay, you answered that. I'm curious to know about something like, we see a lot of frozen shoulder. Do you see frozen shoulder? I mean, you must, right? Can I ask, what would you do? I mean, I know you're going to do, everyone's different with frozen shoulder too, because it could be completely different set of issues, one person to another, and it probably is. But tell me what you would do with this.
Yeah, so much has changed for me. If I think back to studying frozen shoulder, and they were like, oh, there's 3 grades and it goes through 3 cycles, and you have to wait about, it's usually women that are this age, and like
I'm only laughing
because
almost all of mine are men.
Oh, really?
Yeah,
okay.
they are.
Because I remember learning in the textbook going, it's usually, anyway. So it's interesting how the more I do ABC, the more I don't even trust textbooks much anymore, because of the results that we see. I'm like, oh, okay, that completely disproved exactly what was just said there. So a frozen shoulder, again, in my head, someone's coming in and presenting with this. So, rotator cuff is off and there's clicking or locking. They can't lift up their arm. They can't brush their teeth. I mean, you know this. So for me, that is a compensation, chronic compensation. And now it's obviously the body's getting to a point where it can't compensate anymore. So it's literally a crisis time. So I would still do exactly the same process. There are bones that are stuck forward, and there is a reason why your body's twisted that shoulder joint up. So you fix the bones that are stuck forward and you release the meningeal tension wherever those meningeal scars show up, and the shoulder will fix itself. It'll unlock and move again. And again, I don't want to, we get fantastic results with frozen shoulder, and it doesn't take months and months and months. It doesn't take months and months and months. And, range of motion obviously comes back first in a really small way, and then obviously all the inflammation can drop, and then muscle starts to
So
restore.
again, then it sounds like you're going right for those discs that you find that are
Vertebra, the
protruded
anterior vertebra.
anteriorly. Really, man. So by working on those discs that, or on the, would you say the meninges?
The
No,
meningeal scars or the
in the
meningeal
vertebral
adhesions,
body.
and then the actual anterior vertebra, so the building blocks that are stuck forward, we only fix those and the body will unwind and fix itself.
So you said a lot of this is done. I'm sorry, because I have a million thoughts going on, but you're up against a wall. So the therapy, is that largely done on up against a wall and then maybe on a table or bed?
Yeah, so we do
What are you doing up
everything as
against the
much.
wall? Like what happens on the wall?
So we will stabilize the vertebra. So imagine somewhere. Okay, so let's talk about that fold point just underneath, like someone's breast or pec. So if you imagine that fold point, so I do my little tests, I figure out, okay, it's maybe T9, something like that, thoracic 9. So up against the wall, what I'm doing is I'm stabilizing below T9. So I've got my hand at the back and I'm stabilizing on T10. And then
Are you
the
putting like
person is
your
actually,
fist up against it? I'm sorry to
yes,
interrupt you, but
behind them though, Carl. So they're standing facing me and I've got my fist here at about T10.
okay.
Now I have to get them into the injury position so that I can fix T9. So they will breathe in, breathe out, and fall towards me. As they're falling and they loose, I'm going in this direction to now let T9 fall back and drop back. So we hear a lot of things move. We don't always hear things move because if something is twisted and locked in with meningeal tension, it's not going to make any clicks. But I mean, people are crack addicts these days. They just want to hear all these cracks. So I have a lot of crack addicts in my office.
That's a good one. I remember that one. So, okay, I'm getting a picture now. This is really cool. So, if you're going to treat the T9 now, so you're below the T9. Are you
Yeah,
always below? You're below
not
the end.
always below, not always below. And this is where it gets tricky because everybody's body is so different. So
Okay.
sometimes I'm actually above T9, depending on someone's curve. So if they're kyphotic or lordotic, I've got to think about leverage. I've got to think about the force I'm using. It gets really tricky. And the one thing that you can really bank on with ABC, if you find somebody's name on the provider map, if you're looking for someone who's doing advanced biostructural correction,
Mhm.
the people that are on the provider map are keeping up with the current changes because we're always progressing. We're always learning more. We're always changing things because we know more. We're getting better results with this. We're getting better results with that. So you can bet your bottom dollar if you're looking for someone, check the provider map. You know that those people are up to date with their skills.
That's beautiful. That's good to know. I've got to go back just for a second. If you have a few more minutes, I got to go back now. So their back is against the wall, sort of, or and they're facing you. So
Yes.
your arm is around
Yes.
them.
Yes.
So let's just use the example that you're below the T9. You're helping to stabilize that because now as you're stabilizing it, kind of pulling in a little bit,
No, just
or
basically
just
just holding it,
stabilize,
so
or
just
just
holding space.
providing a stable
Yes.
foundation. Okay, so you got that, and then they're
So
coming.
nothing below, in other words, nothing below T9 will move. That stays stable against the
Got it.
wall.
Okay,
Yeah.
that makes total sense
Then
now.
somebody
So, and then
falls and they've got no effort, they're just falling towards me. And when I feel a certain point and I can see I go in a very specific line and I push in this direction so that I can step. So they'll basically end up probably standing quite upright because now I'm going in this direction and then we move T9 back.
yeah, okay.
But
Wow, that
it's
is
got
okay.
so many
This is something I
variables.
never heard. I'm loving this. I'm just curious. I wrote this down too just now. Like if somebody in our business wants to become a practitioner, I mean, what are the prerequisites to become ABC certified?
So what's interesting about that is that you don't have to be like, for instance, a qualified sort of chiropractor.
Okay.
You would or professional. It would do you well to be obviously familiar with anatomy and physiology because we work
Okay.
with obviously everything in the body. But for the moment, if you attend a basic ABC seminar, and then you two of them, so your second one you will be assessed, you will be assessed to, okay, can you do this maneuver correctly? So you kind of get an examination. You get both a theory exam, and then you get a physical exam. And you're also investing in what we call the CCP, which is basically very, very large amounts of information about how this all works with the unwinding, and then all the references I've given you about the research. So you invest some money in the CCP. It's also online as well. And then from there, if you've passed all those tests and you have insurance, you can go ahead and do ABC.
Like liability insurance?
Yeah.
I'm asking for myself.
Yeah. Yeah, look, I mean,
if you didn't figure that one out,
honestly,
because
this tool,
nobody does this around
when
here.
I saw what you do and I looked at your page, I was really excited, because if this is part of your center, and there are so many ABC practitioners in New York, you could honestly let me have a look and see if I know anyone specifically, because I'd really like to refer someone that I know to you to come in and check out your center, or come and give you an adjustment so you can experience it. But that it's not going to take you that long to be ABC certified. I mean, look, I say that I've been doing it for 10 years and I still feel like I'm a beginner. So there's
well, that's how I feel after 14 years in the business that I'm in, doing what I do. Every day is a school day. I'm adopting that. Thank you for that one. I love it. Okay. I have other questions. Do you have another 5-10 minutes?
I've got time. Go ahead.
Good.
Yeah, I've got time.
There's one kind of random question I want to ask here, because I had no clue. And in one of your Instagram reels or some post, and we touched on it very briefly today, but can you tell us about this sheath or protective layer or layers that covers, is it all of the spine or the skeleton, or what is this sheath you're talking about? Because that, to me, that was super fascinating. It's almost like, fascia to muscle, sort of, but what is protecting our spine? What is protecting all that stuff?
Well, I think I was referring in that video to the meninges, which are very fibrous, very thick. They've got obviously a blood supply to the spinal cord, so that it can keep alive. So you've got quite a fibrous kind of skin of like a layers, and it's got 3 layers to it. So I was talking about that, and I think in that post I was talking about how come people come to me and I do something, they've got a disc, a lumbar disc. So, okay, I've been diagnosed with a hot lumbar disc. I've got neurological signs down my legs. I will do maybe 1 or 2 things, maybe a stretch. So one of the meningeal stretches show up and I do that. They're like 50, 60% better before I've even continued. And that what I was trying to get around was that when the meningeal tension is very, very tight, if there's a disc that's even slightly poking into that, your symptoms can be through the roof. So if I go in there and release the meningeal tension, you still have the disc issue, you still have the disc herniation, but because the tension of the meninges is less, symptoms will drop. Okay. So that's
fascinating. And let me ask another question. I feel a little weird asking this because I feel like I should know, but is there fluid? Because fluid is there fluid in the meninge? I'm sorry.
I'm unsure about that, actually. I think
the reason I ask is there's fluid in so many places. We have, when I was talking with Perry last week or 2 weeks ago, we were talking about the lymphatic system, and man, that was just mind-boggling. All the stuff that we learn about the lymphatic system and what it does for us, and how it can mess us up if it's blocked anywhere, right? So we have lymphatic fluid flow, blood flow, fascial fluid. So there has to be other fluid too. And so I was just curious about that.
Well, remember what the meninges is encasing, because it's the brain and then it's the spinal cord, the cerebral spinal fluid is there.
Yeah.
So when people puncture the meninges, they do that spinal puncture to check if there's anything, any disease or infection inside the cerebral spinal fluid. So they do that lumbar puncture at the bottom. So they're going straight through the meninges to do that.
Okay. Pillows. Tom, talk to me about pillows. ABC pillows, or is that what they're called?
They can, you can call them. I mean, you can buy them online. They're adjustable, like sort of different layers of pillows. But just to frame this, when I'm working with someone, I'm like, look, if you want to get results, it's 50% me, 50% you. So we're a team. And the things that you can control is what you sleep on. So pillows, mattresses, and bed frames. What shoes you wear. Nice, yeah, there's my pillow.
I love that.
So what shoes you wear, what you sleep on, and then obviously what you sit on. So your car, where you do your work, and where your couch is. So if people can make even the smallest of changes. So if anyone's listening now, it's quite a cool little experiment to do. There's two parts to it, really. One is if your feet are flat on the floor and your body's completely relaxed, turn your head to the right as far as you can turn, and then turn your head to the left as far as you can turn. Now, some of us are going to obviously feel one side maybe more stuck than the other. We might have a bit of tension, maybe even a bit of pain somewhere. So now scrunch up your toes as tight as you can on the ground. So as tight as you can. And now do the same thing. Turn to your right and then turn to your left. Now, some people are going to find that their neck moves slightly better in one direction. Some people are going to find maybe it gets worse altogether. But that's just to show you that we're one synchronous unit. So we can't do one thing on one side that's not going to affect something on the other, especially from a range of motion perspective in what we're speaking about today. So the second part I want you to consider, and this is probably a bit more of a thing to do maybe when the call's finished, is if you're sitting on a chair that's slightly bucketed, it'll be a problem. But if you're sitting on a pretty flat chair, this is probably going to work. So feet flat on the floor, sit right back at the back of the chair. And then if you relax everything first and take a deep breath in, so all the way in, just don't worry about where you're breathing from, stomach or, chest breathing, just take a deep breath. Okay, so make a note of that. Now, go into your kitchen or your bathroom or something and fetch a towel that you can roll up. So roll up the towel like a sleeping bag and stick it to the back of your chair, so where your butt bones are. Yeah. But you probably need a bigger one than that, Carl, because if you have a look at this, look how, so I'm actually sitting on a seat wedge.
Yeah. Okay.
Now, the wedges are obviously, you're busy putting a towel and rolling it up and putting it under your butt bones. So it's not in the small of your back. It has to be under your butt bones. But as you're sitting, I want you to make sure that your hips are higher than your knees. So that towel has to be big enough to get your hip bones at the top, so your butt higher than your knees.
Not quite there, but I have something here I can do it with. I'll do it in a while.
Yeah. Brilliant. And now relax and now breathe. So even if you take a breath now, you'll notice that it might be easier to breathe. It might be a bigger breath. It might be a longer breath. When you breathe out, you won't collapse as much. So that's a really
an idea.
quick little thing.
Are you there? Can you do me a huge favor and bring me over one of those ab mat, sit-up things? Yeah, they're black and red. Get rid of the towel.
Is it kind of a wedge? It's amazing the difference you'll feel.
Yeah. This is cool.
So sitting pillows, sorry, you spoke about pillows. Pillows are adjustable layer pillows.
So much. I got one of these. Let me try this. Okay, now my hips are higher than my knees.
Your butt is higher than your knees. Okay, get comfortable and now take a breath. Well, already you can see your posture's changed completely. Your shoulders are
wow. Back. I mean, yeah. I mean, I can't even believe how much deeper I can breathe. Whoa. Yeah, and I have a history of lung problems, although they're much better than they used to be. But deep breathing is real important for me. Well, probably everybody, but it's helped me a lot. Wow, you know what? This should be a no-brainer, but I never thought of it. So thank you for this. This is a gem.
But on that chair, that looks like quite a fancy one. Can you tilt the base this way, Carl?
I cannot. You mean forward?
Yes.
No, I can't do that.
Okay. No. All right. Also, with office chairs, you don't really want to make them swingy so that you can lean back on them, because you're going to be basically all day, you're going to be swinging on your L5 there, which will be a problem. So you want to be as stable as you can with the chair that doesn't move around.
Yeah, I'm going to do all my interviews sitting on this thing now.
Nice. You'll see your energy levels will be completely different because you're breathing differently, and then you're breathing with less effort. So now you've got more effort, more energy to focus and, think about things.
Well, so that brings me to a thought here. And so I got to go off on just a little tangent for a moment. But if we think about this, the body as being a one, like Dr.
Sequence.
Perry said, I'm sorry I keep referring back to him, but I'm going to introduce the two of you in an
Yeah,
email.
that's
You
you.
have to know
Yeah.
each other.
Okay.
Absolutely. He's chiro by trade, who doesn't
Okay.
chiro anymore. He does everything
Okay.
except chiro pretty much.
Okay.
So he's one of the forward thinkers out there. In fact, he wrote the forward for my first book I did, and that doesn't matter. It's just that, I mean, it does to me, but it doesn't relative to what we're talking about now. He said too, also 2 weeks ago, the same thing that all of you brilliant people like yourself say is that we know the body is a set of systems. The body itself doesn't say, oh, this is my vascular system, this is my skeletal, this is my muscular, this is my lymphatic, this is my whatever. No, this is my body, and it's all one, because everything I've been teaching this for years. Everything is connected to everything else, and if one system isn't functioning optimally, then by default, all of the other systems are brought down. Even if it's almost immeasurable, there's a little diminished, right? And so over time, more dysfunction, a little at a time, little at a time, little 30, 40 years later, you could really be in some rough shape. So with that said, that's just one segment. The next thing is we think about what do we need for this body? Oxygen is the healing power. From my understanding, please correct me if I'm wrong, if you know I'm wrong. Cancer doesn't survive in an oxygenated environment, but it thrives where there's no oxygen. We know that oxygen heals. Well, we need to be able to breathe deep enough. We need when we use different therapies here to bring blood flow to certain areas of the body.
Yeah.
Well, maybe it's pain. Maybe we put them we have the top end power plate here. We love it.
Mm-hmm.
You come in with neuropathy or rheumatoid arthritis in your feet, and you get circulation going by vibrating, stimulating it. Bingo. Pain not necessarily gone, although in some cases it's gone. Might be temporary, might be for a week or two or three, might need to be a regular treatment. But oxygen is like, obviously it's a no-brainer. We need that. But I'm thinking about what you do. I'm thinking about these vertebrae, the anterior vertebrae, how it can mess us up, how we can twist ourselves down into a situation or a posture where we can't breathe as deep. It just seems like it could be a recipe for disaster, not only just pain and dysfunction of muscular and skeletal and all that, but maybe even disease. I don't know,
Well, this is Jesse has said, he's like, these anterior bones are the cause of all disease. So if you can fix
Wow.
them, get them fixed in your body. I mean, because,
No kidding.
like you were saying with the lymphatics, when a body is twisted, it's affecting the lymphatics, it's affecting the vascular system, it's affecting the neurological system, it's affecting the muscular system, it's affecting the organs. So it'll be digestive system, it'll be affecting, if it's meningeal, if someone's under a lot of meningeal tension, it'll affect your hormones because it's a distribution. It's structure equals function on such a global scale that for me, and what I do and what I love, this is where the foundation is. You get your posture right, and a lot of things can change.
I've got to add one more thing. It's kind of out there a little bit, but it's a true story. I won't say who, but well, let me ask you this. So I can imagine that this can affect your ability to go to the bathroom, like
Yes,
constipation might come, right?
yes,
Okay.
yes.
So with that said, a very, 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 very close family member who passed away from constipation.
Really?
And
Wow.
yes, constipation. And this is a horrible, horrible thing, but because of his state where he was physically and all that, no intervention could be done without him dying from that. So I mean, if you think about a backup, I know it sounds disgusting, but this is actually real life stuff. I mean,
Yeah.
this is the real world we're in, right? And that's not going to do you any good if you can't go to the bathroom and, have a bowel movement, because the toxins are going to get, it's just your body takes them in and then they take over at some point and you're done. So I'm making a very, very drastic, extreme connection here, but it's actually relevant
Very.
because those things do happen. They are not common, but they happen. So posture. Oh, I got to work on my posture. Yeah, hook me up, will you? Hook me up, because I've got to check this out, and then I'm going to go to school for it.
There's not much actually more to say, because the proof is in the pudding. When you experience it yourself, there'll be no words. But it's there's definitely things though that people can do at home that could prevent their problem from getting worse. Sure. And that is where the seat wedge, so sitting with your bum higher than your knees, as a principle. So any theater, any movie, any restaurant, any taxi that I'm in, I'm always focusing on, okay, can I put something under my bum to make sure my hips are higher than my knees? Because I want to protect myself.
Yeah.
Sadly, and I have to mention this, a lot of the mainstream exercises that people will do in the long term is actually making people's postures worse. So things like yoga and Pilates. Now, it's not all of it. It's just specific parts. And, I can speak from experience, because I've obviously, as I said, been doing ABC for 10 years. So I've probably been like a really strict with my own body, maybe for about 8 of those years, where I knew more about what to do with my training and what shoes to wear and how to sit and things like that. So I went and had a Pilates session with a local person down the road, and we decided to just go ahead and do the mainstream Pilates flow. Okay, great. I'm going to do it. I had a great time. My body was activated. My muscles felt good. After the session, for myself, I was slightly dizzy. I was floaty. I couldn't take a deep breath. My knee was sore. For that week afterwards, my jaw was out of place. I kept biting my cheek. Yeah. And then my hip was sore, and I was like, oh my gosh. So it made me realize that actually how important it is for me to mention this. There's great things in yoga and Pilates, but there's also things, if you leave them out, you will prevent problems in your life and injuries from happening, 100%.
Okay.
I've got a yoga, I sat down. I love yoga. It's got a good, stress release, and, your body's moving and you're breathing, and I love it. So I sat down with a whole bunch of really experienced yogis. It was about 30 of them. And we came up with a yoga flow that is safe for your spine from an ABC perspective. So it doesn't create these bones that are stuck forward. So I have that on my website. So it is a product of ours. It's called ABC Yoga, or spine-friendly yoga. It isn't a product of ABC International. I call it that because then I can send my clients there and say, there it is. But it's actually just a spine-friendly yoga that I've come up with. And something basic that maybe you could keep in mind, or I'd really like you to consider in your work, is any exercises that are creating hyperflexion or hyperextension of the spine. So hyperflexion or hyperextension, those are the ones that we leave out.
Okay.
So it's things like roll downs or hip thrusts. It's things like crunches and sit-ups. It's things like putting a bar on the back of your head to do squats, doing deadlifts. They roll you forward quite a bit. So those are the things that, if I was going to prevent problems and worsening my posture over time, those are the things I'd stay away from.
Okay. Yeah. Well, that's why I have you here, is to learn. And I've learned so much today. Can't thank you enough for your time. I am going to say one other thing, but I'm just going to qualify it by saying, first of all, I don't know that much about Pilates and yoga. I almost made up a new one, Pilates and yogis.
Yeah, you did. The logo.
Oh, what do you know?
The logo, that's good.
Okay, well, anyways, Pilates and yoga. What I can say, though, is this. See, there are people who argue with me on this, but you don't argue with me on it, because I'm saying that I don't know that much. So I don't know that much. But what I will say is, in my experience for many, many years, I see people in those classes experiencing all kinds of problems and pain, and they're looking to get strong, and they're looking to burn fat, and they're looking to change their body composition. And I could be totally wrong, but I don't think it usually happens like that, especially if you're having pain, you're having problems as a result, and you keep going back thinking you'll make it better. Yes, I know for sure there are a lot of great things in both, but be careful and make sure you go to somebody who knows what they're doing, because you can really screw yourself up in those, I see more, as a friend of mine in New York City says, he sees more, as many injuries from yoga as he does from CrossFit.
Absolutely,
Yeah.
100% right. With those yogis that I worked with, there was about, as I said, 20 or 30 of them in the room that we did this flow with. A lot of them were very experienced. So they were like 20 years, 30 years of, like 20 years maybe, of yoga. So when they did this flow, we asked them what they felt about it. Like, would they teach it? Would they be happy to, have classes with it? And all of them have said that as they've gotten older, they can't do the same poses of what they did when they were 10 years younger. And I was like, well, if yoga was going to be such an answer to your longevity and your flexibility, why are the yogis that are doing maybe 3, 4, 5 classes a week, why are they not maintaining or even getting better with their flexibility, their strength, and their posture? They're all getting worse.
Thank you. Yeah.
So it made me think, and I was like, so you guys have answered the question for yourselves.
Yeah.
And then, Carl, one more point, please.
Yes, please. Yep.
Again, to consider again with your clients, no memory foam mattresses. Do not sleep on a memory foam mattress at all costs. If I go anywhere and there's a memory foam mattress, I sleep on the floor. I can't, it would make people
I don't know anything about them other than I just can't imagine they're good, and I would never recommend one, and I don't have one, and I'll never have one. If coming from you, that means a lot, though. Thank you. Yeah.
Yeah, well, even with the client, like for you, with someone Alzheimer's, MS, dementia, if you are creating more kyphosis and more twist on their neurological system, that's just more something more they have to deal with. So definitely no memory foam mattress. That's my main takeaway.
Well, before we sign off, I want to ask, where can people find you? Okay, they want to contact you, they want to interview you, they want to have an appointment with you. Where do they find you?
So we obviously the website, so spirohealth.co.uk. So that, no, is it? Yeah, I mean, we run the website. So spirohealth.com.
Okay, and I'll have it in a description and a link in the description below, and
yes,
all the platforms
link in the description. We also, so for people that we're far away from, we have virtual calls. So I have video calls with people. I have, you can book those online. I have, those are complimentary. So it's just like a catch up, a chat. You can ask me questions. And I also have at work, I'm in London, the UK, obviously in a town called Putney.
One of my favorite cities.
Pardon?
One of my favorite cities. I love London so much.
Yeah, it is a great city. It is a great city.
So are you north, south, east, or west of London? Where you are?
Southwest, southeast.
Are you near the airport, sort of?
No. So we are very close to London town. So we're like 2 stops away from Waterloo, which is the center.
Oh, I know exactly. Okay, I remember on the tube.
Yes.
I remember the stop on the tube.
Yeah.
I love how they call it the tube.
I know.
Here's another thing. This is totally random. So my first trip there years ago, it's like 7, 8 years ago. I'm going down in the tube for the first time at a big station. I don't know where, somewhere central. And it's like 5 p.m., 5:30, whatever. Tons of people out there. And I come down the escalator, really long way down, and people are standing in lined up for the doors for the tube.
Yeah.
It's like, wait a minute. What's wrong with this picture? Because in New York City or any other city here, it's massive. You just shove your way through. And so people were dressed better. I noticed that a lot of the men, young gentlemen, were dressed in like nice clothes, maybe a jacket, maybe a suit and tie, and looked good. Haircut's nice, and they weren't walking around like I was with sweatpants and a t-shirt on, Then I felt like, well, I need to dress up. This is a classy place. But what I really thought was cool is the respect people have for each other in the tube. Seriously, folks,
True.
it's
British
really
people
cool.
love to queue. British people love to queue. They really love queuing for everything. Yeah,
You don't see that in New York. It'll never happen.
really.
Okay.
No,
Have you ever been to New York?
I haven't.
Oh, you got to come to New York City.
Yeah,
I
I
mean, I'm
do.
4 hours away. It's like, I don't know how many kilometers, but 200 miles. So
Okay.
4 hour drive, 1 hour flight. But yeah, I mean, it's a cool city to see at least once in your life. So we know we're your website and
Yes. And then there's on Instagram, I'm very active on Instagram,
yes, you
and
are
there is
actually. Yeah, thank you. Yeah.
there's a score, there's a in my bio, there's a short postural health quiz. So if you're
Okay.
wondering if, okay, is this something I could benefit from? Go and do the quiz. It's just, I think it's about 18 questions, just yes, no answers. So once you get that, you'll get some results explained. So that's a good way to figure out if it's something that can help you.
Posturalhealth.score app. Okay. Yeah, I'm just looking at it right here. Do you need to fix your posture?
Yes, that's
Yeah,
it.
by the way, folks, her Instagram channel is really, really good. And that's where I've stalked you mostly, is Instagram. In fact, I have it so that whenever you post, I get a notification because I want to keep up on things.
Oh,
Yeah,
cool.
because this way I keep learning. And, it's one of the most educational channels that I follow out there. It's yours, and I love it. So,
Thank you, Paul.
well, any words of wisdom before we sign off? Any final words of wisdom for the listeners out there, the watchers? Because takeaway message, fix your posture, right?
Well, yeah, I mean, that'll
One
be
thing.
a given, hopefully. Hopefully I've got that across today,
Yep.
fix your
Mhm.
posture. But for me, I think something that I follow in my life, which involves everything. The small things are the big things.
Can I take that one too? Every day's a school day. The small things. I'll give you credit for everything, but
Small things are the big things, and then crack addicts, that's always cracks me up.
small
But
things.
yeah, the small things are the big things. Because even with posture, if you just change your pillow height, your whole life could change. If you just change the shoes you wear, if you just sat slightly differently in your office chair, changes your life, changes your breath, changes everything.
Love it. Fantastic. Well, Natalie, thanks so much again for joining me. It's really great to meet you. You have so much to share. We're going to have to do it again sometime down the road, not too long from now, and dig a little deeper.
Well, let's do it when you've had an adjustment, so you can.
Yeah. Okay, we'll do that for sure.
Yeah.
All right. If you don't mind, just hang on for me after I say goodbye to everybody.
Okay,
Just hang on for 1 second. So, viewers, listeners, thanks so much for watching. The best way to support this channel is to hit the subscribe button on whatever platform you're on. Follow, subscribe, and if you like it enough, maybe even share it with a friend, because we are looking to reach the world and make some changes. One interview, one educational moment, one phrase away. Like, the small things are the big things. Every day's a school day. All those things, these things add up, and they can make a huge difference for somebody, and that's what we're here for, is to help humanity. So hit subscribe, hit follow, share. And Natalie, thank you. Viewers, listeners, thank you.
So much.
Hope you all have a great day. Take care.